I am the head of admission at Jindal School of Public Health. Warm welcome once again, and I request Professor Stephen Marks to join us for a detailed introduction session and thereafter other dignitaries. So over to you, Professor Marks.
Thank you very much. It's a great pleasure to participate in this effort to share what the Jindal School of Public Health and Human Development is all about and what it can mean for people's careers. My first task here is to tell you who I am, because I'm probably an unknown quantity to all of you. I am the founding dean of the Jindal School of Public Health and Human Development. I come, as you can probably tell from my accent, from the United States of America. I was brought up on the West Coast of the United States and went to Stanford University. And from there, I pursued higher education in Europe, gaining several degrees from various universities in France, and started a career in the United Nations system. I worked for the United Nations Educational, Scientific, and Cultural Organization, UNESCO, for a decade or so, and then I joined the Ford Foundation. And at the Ford Foundation, an international philanthropy organization, has funded health and other areas across the world. And that was a very exciting prospect for me before I shifted into an academic career, having been a professor at Columbia University and at Princeton University. I returned to the United Nations to be part of peacekeeping operations for a few years and gained experience in the field dealing with conflict situations, primarily in Cambodia and the Western Sahara. And then I joined the faculty of Harvard University at the what was then called the Harvard School of Public Health, now the Harvard T.H. Chan School of Public Health. And I joined that in 1999. And after 23 years in the Department of Global Health and Governance, and having been the director of the François-Xavier Beigneux Center for Health and Human Rights at the Harvard T.H. Chan School of Public Health, I left that position last year to be able to join in this exciting adventure to launch this India's first interdisciplinary school for public health and human development. So I hope to tell you a lot about that, but there's a brief introduction to who I am and how I spent the last 23 years working on public health issues across the world during my period at Harvard's T.H. Chan School of Public Health.
Thank you, Azad. And it was great to be in company of people like Professor Marks and Professor Nandita here. Thank you for this opportunity. I'm Professor Nitesh Bansal. I am a physiotherapist by training, did my bachelor's, master's, and doctorate into that, been into academic administration, and I have a responsibility at Jindal School of Public Health and Human Development as a vice dean of international collaboration and external engagement. I primarily look after the internship placement and other engagement with agencies other than the university in terms of collaborating with them, identify the area where we can work together, collaborate, and give a great experience to our students so that they have a great career and professional life ahead of them. I have been associated with many state private universities in the past in India, being a registrar, a deputy pro-vice chancellor, and now working as a chief compliance officer, professor and vice dean at OP Jindal Global University for just over a year now. So look forward to more interaction with you.
Hello, everyone. Good morning. Really nice to meet you all. My name is Nandita Bhan, and I work as professor and vice dean academic affairs at the Jindal School of Public Health and Human Development. My career has spanned a sort of a transition from, like, my first degree was in economics, and like many of you who are thinking about a career in public health, I also came into public health from the lens of development studies and sort of the human development perspective. Following my bachelor's and master's in India, I did my first training in epidemiology at University College London a long time ago. And that was followed by my PhD training at the Harvard School of Public Health and focusing on social and behavioral sciences. So since then, I've moved back to India and I've been working in public health, looking at issues around social inequalities in health, looking at particularly the gender perspective in health of women and girls and adolescents, and that's been my core interest area. I'm really looking forward to meeting some of you as you join JSPH and working with you all in terms of developing your competencies and our mutual interest in pursuing the health agenda forward. So thank you and welcome.
So over to you, sir.
Thank you very much. I am going to speak for the next 20 minutes or so on the matters that are listed on this slide. If everybody can see the
Yes,
slide
we can see.
presentation, that's all visible.
Yes.
So I'm going to try in 20 minutes to cover these 6 topics. And as Vice Dean Nandita Bahan explained to you, that she came to this interest in public health from a focus on human development. And we need to see, why is this school called the School of Public Health and Human Development? So that'll take some definitions. And then I want to talk about some exciting features that make public health such a worthwhile field to engage in for a master's degree. And then to focus on the methods that are used in public health. That suggests, of course, the methods that you would become familiar with as master's students in this field. And in order to acquire the core competencies that prepare you for a career in this area. And then I want to focus briefly on the unmet needs of public health workforce to show how desperately Indian society and globally trained people in public health are needed. And that will lead me then to show what is the structure of the MPH program, so you can see how we go about trying to prepare people to make those needs. So let me spend a minute or two on the core definitions. Many people confuse the medical professions and the public health professions, because it is true that there is a tradition of medical doctors to address public health issues. But if you are considering this for a career, the core distinction that you need to be aware of is that physicians, people trained in the medical sciences, deal with their individual patients, and they do something absolutely wonderful to save lives and cure diseases and so on. And they use their scientific knowledge to help individual patients. When that scientific approach to dealing with such problems is graduated up to understanding how these problems can be addressed at the level of populations, we're really in the core of public health. So it focuses on the health of entire populations. It is distinguished from what people often refer to as the biomedical approach, in which you try to cure diseases and injuries. In the public health approach, you address preventively the needs of populations. So that is why it is called the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society organizations, public, private, communities, and individuals. And that brief definition gives you a sense not only of what you need to learn in a master's program in this area, but also of what are the types of career prospects open to those who graduate. Now, there is a controversy regarding the definition because people do tend to confuse the biomedical model with the public health model. And a number of great scientists of the previous century had convinced the United Nations system after World War II to base the World Health Organization on this broader definition of health. So we in public health attach a lot of importance to the definition of health as provided in the Constitution of the World Health Organization, which says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That is really core to what this profession is all about. And I think those of us who are in it, and I think that Nandita express this passion that we have for seeing this holistic approach to health. Now, we have today people addressing planetary health and One Health and various other concepts that stress the relationships beyond our own species, connecting to other species and to the planet, which is a broader understanding of health. There are also some people who include in this definition spiritual, complete physical, mental, social, and spiritual well-being. And that's also a legitimate concern that people in public health can be involved with. And that is why, of course, homeopathic medicine and traditional cures are also part of public health. It's not limited to any Western model. So now that leads us to the second part of our school's definition, public health and human development. Why do we call it human development? Now, people working in the medical field consider that human development is how the child evolves and goes through the mental transformation that through the lifespan of becoming a full human being at the individual level. And that is a correct meaning of human development in the medical sciences. However, it has acquired a different meaning. It has acquired a different meaning in international relations and in international development studies of an alternative to the growth-based model of development. Many people consider that development is measured by gross national product. But in fact, this insight has led the the United Nations Development Program to identify growth as a means and not an end to development. So human development is much more than the rise and fall of national incomes. It's about creating an environment in which people can develop their full potential and lead productive and creative lives in according to their needs and interests. Therefore, as I said a moment ago, economic growth is a means and not an end to development. There is no automatic link between high GDP growth and progress in human development. Stop and think about that for a while. High GDP growth, yes, you can have rich people and large sums of money in the treasury with poverty all over the place, with inequalities and injustice everywhere. So the Human Development Report, which you can see the latest version of here on the screen, addresses these issues systematically and over time. The idea that convinced the United Nations to take on the concept of human development owes a lot to an Indian philosopher and economist, a Nobel Prize winner, Amartya Sen, who, as you can see by his definition here, stresses the advancing the richness of human life and the richness of how human beings live, and his publications are kind of the foundational sources of our reflection. And he has a direct relation, as I said, Nobel Prize winning economist and world-renowned philosopher. Amartya Sen has provided an understanding of human development as an alternative to the growth-based model of development and managed to translate that into the essential policy of the United Nations Development Program. The concept of human development also owes a lot to other philosophers and legal scholars and so on, and Martha Nussbaum being one of them. And so one of the things that you learn in the O.P. Jindal School of Public Health and Human Development is the broad understanding through these different thinkers and their efforts to implement the concept of human development and capabilities. And so I think that as a starting point for the definition, to understand what is human development and what is public health, and I hope I've communicated the essence of it. But my second point here is the interdisciplinary nature of public health studies. Now, you would expect, if you were taking a master's degree in public health, that indeed there are numerous scientific fields that are relevant, obviously biology and medicine. And what the core skill that you acquire in public health is epidemiology, how you can measure evolution of diseases and trends that affect global health at the population level, which requires knowledge of biostatistics. But also you need the technical knowledge of nutrition so that you can understand how the human body is affected by what is ingested. And there are also philosophical concepts that are translated into the concerns of health and medical practice, and that takes us into bioethics. And you need to understand how populations function, so demography is important, and economics, and environmental studies. Now, these are the disciplines that I think, without even giving it much thought, you would say, yes, if I'm going to study public health, these are the sorts of things that I'll probably study. What you may not know is that in our experience in public health, it is in a sense a university within a university. In the department where I spent 23 years of my professional career at Harvard of global health and population, we had historians, we had political scientists, we had lawyers, we had anthropologists. I was involved in human rights studies. We had human rights specialists, sociologists, psychologists, philosophers, humanitarian studies specialists. So you can see that the interdisciplinarity goes beyond those disciplines that would be core to addressing population level health issues and address broader social issues to understand human beings in society. Now, in order to apply that interdisciplinary approach to public health and human development, there are certain methods that are used. And this is one of the exciting dimensions of public health studies, is that normally, as a scientific field, we are using empirical methods. The research carried out in public health are scientific approaches to using clinical trials and field studies and randomized control trials and other scientific methods in which research is conducted using an inductive approach to acquiring knowledge. But the point I want to make here is that it's not the exclusive approach. It is not just analyzing populations and statistics and so on to say, therefore, we understand that this particular effort to address COVID-19 failed and this other method succeeded because of the data that you can see on table 4. That's fine, and that's a very important part. But we also use normative or deductive reasoning for policy analysis and human rights research and global health governance and public health ethics, addressing inequalities and so on. So the scientific approach to knowledge is very, very enriching because it's not only pure science, but you add to it normative sciences, normative approaches to deciding what are the best policies to use, what will enhance justice. Now, there's a technical approach as well, and I'm not going to spend much time on this because the slides I'm about to show you are far too detailed since they're taken from a detailed table. But the foundational competencies that are used were those developed by this Council on Public Health Education, and these detailed competencies that you can read in our brochure focus on evidence-based approaches to public health, planning and management, certain key competencies, communication and governance, and so on. And the point I want to make is that that wide range of competencies that you need to acquire to become a professional in the public health field are for a major purpose, which in public health we call knowledge translation. World Health Organization quite rightfully pointed out, knowledge derived from research and experience may be of little value unless it is put into practice. So there's the great excitement of the public health field, which is that you conduct research and investigations, you acquire knowledge, not for knowledge's sake in itself, which is certainly legitimate in a learning environment, but to put it into practice. And where do you put it into practice? This is called knowledge translation, or bridging the know-do gap. Stop and think about that a minute. The know-do gap. You know something because you studied it. What good is it unless you do something with it? And where do you do something? Well, you do something in strengthening national health systems. And from this point of view, I want to mention that the Lancet Citizens Commission on Reimagining India's Public Health is one of the best efforts to consider the total national health system and what needs to be done to make it a more effective delivery system for public health. But it goes beyond the national level. It goes to global health governance, so that public health emergencies of international concern and the Framework Convention on Tobacco Control and international health regulations, those are all activities of the World Health Organization that help global health governance advance. But also humanitarian assistance in crisis situations. And we're now witnessing, of course, horrendous situations of the earthquakes in Turkey and Syria. So those are public health people that are going to the rescue there. They know what needs to be done to provide relief. And they mobilize in other settings for the full range of public health concerns and equity concerns through civil society organizations. These are the places where the knowledge is translated into action from public health. And therefore, what I was just talking about is that the state of the public health workforce is deplorable, frankly, across the world, and particularly in India. And you have some statistics here that show it, but I don't want to take too much time because we want to give others an opportunity to talk and you an opportunity to ask questions. But in India, it has been reported recently that India needs at least 1.8 million doctors, nurses, and midwives to achieve the minimum density of 45.5 health professionals per 10,000 population. And there's currently half of that. So we need to double the health workers, the doctors and nurses and midwives and so on. We need to double that workforce. So the enormous gap in the public health workforce is one of the major challenges to public health. And those who pursue a master's degree in this area can play a significant role of contributing themselves to changing this, to shifting towards meeting the needs of the public health workforce, but also to training others to go out into the professional world and alter that gap. And forecasts show that the number of public health professionals may or may not achieve the needs, but we don't have time to go into that. The main point here is that the supply of public health education is inadequate to meet those needs, and we need to increase public health teaching in universities. And that leads me to my final point, which is, what is our MPH? What are we offering you? So the mission that we have defined for our program, our school, our master's program, is to train global thought leaders to strengthen the governance of public health in India and across the world by positioning India to provide these leaders in public health innovation and to inculcate a global perspective, and that's where our human development comes in as well, and to promote cutting-edge research that fuels innovative public health, not only for India, but across the world. I think you get the message that we are quite ambitious in seeing the Jindal School of Public Health and Human Development as a place where you can become part of a leadership workforce to transform public health in India and the world. So in order to do this, we have a two-year program, and there's some core competencies, core requirements in your first semester of the first year, which include social determinants of health and human rights and ethics and epidemiology and nutrition and so on, as the starting point of the core knowledge that you immediately put to the test by going on an internship during the month of January. And then you come back, and this is what we're doing now, to advance your understanding of research methods and human development and critical reading and writing, environmental health, and so on. And then you have a summer internship and come back for year 2 to study community health and demography and population studies and health promotion and communication. And you can take electives across the entire university where there are scores of really valuable public health related subject matter that are not taught in our school, but taught to our students from other schools across the university. And then these electives you can draw upon to study for the final semester, political economy and so on, and prepare a thesis, but also to engage in a specialization. We have 6 specializations that you can engage in so that when you graduate with your MPH, you also have a specialization that is of relevance. And the faculty that are providing this learning include 3 people who are here today, and myself, and that is my timer. So I'm doing very good on time with Professor Nitesh Bansal and Nandita Bahan, and then our other distinguished initial faculty of the School of Public Health, Shamin Mohammed and Swati Narayan and Sambhuta Chowdhury, and at least 20 or 30 distinguished faculty members of other schools in the School of Government and Public Policy, in the School of Environment and Sustainability, in the School of Psychology and Counseling, in the School of International Affairs, where there are outstanding professors who teach public health subjects. So with that, I'd like to conclude my presentation to introduce you to what the field is all about and what the MPH offers.
Super. Wonderful. A great presentation, Professor Marks. Thank you so much. I will request Professor Bansal to begin his presentation.
Thank you. Thank you, Ali, and thank you, Professor Marks, for setting the tone right and doing our task easy. So that's easy, giving such a broader and such a deeper view about the School of Public Health and Human Development and the program of MPH per se. So very good morning to each one of you. I'm here in the capacity of Vice Dean, as I shared in the morning. I will be sharing some lights on about the career aspects and the collaboration, what we have at, the career opportunities after you finish your MPH, which in the School of Public Health and Human Development. The openings actually are leveled at every level under the sky. Like we can start from the government, which is at local, state, and national. Local means the municipal corporation needs experts who can advise and collect data and tell them in policy making and implementing those policies. Of course, state government, not only in Ministry of Health and Family Affairs, there are also other allied department which takes care of public health. The departments who frame, formulate policies or implement those policies related to safety, healthcare, like they take care of healthcare workers, they take care of population in general, sanitation, etc. anything. And of course, at the national level, similar structure exists. So government level, when there is ample opportunity, there also exists opportunity in the not-profits or NGO sector, national, both as well as international. I'm sure all of you have heard the big words, the NGOs who are working in the health sector, like World Health Organization, United Nations, the RAND Consortium, and all this, Center for Studies and International Studies. So these are the organizations who work, like for national level, we have Public Health Foundation of India, international level, as I said, Food Foundation, and all these people who work and make those policy documents, which becomes a referral document for the governments to make policies and schemes for their general public. Private consultancy organization like Chatham House, Public Health Foundation of India, Center for Strategy and International Studies. They are the major one. Apart from that, we have think tanks who are exclusively working in the domain of public health, like there is Smile Foundation. These are again comes in both the heads in terms of NGOs as well, and think tanks also who assist government in formulation of policy documents. Educational institution, you can always be a teacher in any field where you want to go. There are great reputed school at national and international level where you can get into, and of course research. All these organizations also have research center where they employ people who are expert of public health doing their master's degree, and they can help the senior researchers, and then you can grow in that profession to become a researcher yourself. So these are some broad area where people work in that. We have more than 375 international university collaborating with Jindal Global University already. Many of them have already shown interest in collaborating in public health as well, which means there will be a two-way collaboration where we will have at the student level and also at a faculty level. So this both kind of a setup will ultimately lead up to helpful for our students who are doing it. As you see in the map, the collaboration is really across the globe, covering each and every continent and almost all the prominent countries and reputed universities who are known for their academic rigor. These are some names to give it. This is not an exhaustive list. Not all of them have a collaboration with public health as of now, but this is in the university level, and many of them have already shown interest where we are doing it, and we are exchanging ideas. Every month, we have one or the other meeting with any of the international universities regarding our public health program. And I'm sure when you join a public health program at Jindal University, you will have the opportunity to spend a semester, 3 months, or 15 days in any of the chosen or a partner university to get exposure of that particular country. I am sure this is something very important for each one of you regarding compensation package. Like any field, again, in public health also, it varies from organization to organization and your level of competencies. Like you can't have a ballpark figure which fits into all. So it depends on your skills and credential and what actually you bring on table to the organization. If I have to give you a rough idea, it can vary between 3 lakh to 12 lakh. I know this sounds quite a broader range, but for an MPH graduate, depending on what kind of a role you are ready to play and what's the requirement of the organization, you can easily expect, average about, although I've written 8 to 10, but I think about like 6 to 8 would be a right figure for a fresh graduate. And then, of course, as you grow with your experience and your performance, it's only set to grow further. International career series, as it depends on country and the organization to you work for. So this is something which we'd like to share about the international exposure, or something which we do at the Jindal School of Public Health and Human Development at the international. Some organization who are already in touch, one batch has already undergone a winter internship, which is a small, where you have to, experience working of an organization. Some of these potential recruiters and partners like FXP, we have already signed with them. Good at Technology, Tata Steel, Mex Healthcare, Engender. We are soon going to be in partnership with various other organizations, including Public Health Foundation of India, the Max Healthcare system, where we want to have our have our students to practice with them and help them in the domain of public health and human development. And this is only a beginning, which will set to grow now, and we'll have many more coming our way. So this is from my side as of now. We'll be happy to answer any question at the end. Thank you.
Wonderful. Thank you. Thank you so much, Professor Nitish. This was really enriching to understand how the industry functions and what are the pay skills available in the industry in India as well. So wonderful. We are now shortly going to open the floor for the questions, though we are very closed event today because of the people who have joined. I'm sure you all are the most interested candidates who are in this wonderful session today. So before I open the floor, I just wanted to show you how the campus looks like, a university film, a very short university film.
OP Jindal Global University was founded in 2009 as a non-profit, multidisciplinary and research-oriented university. JGU was established as a philanthropic initiative by its founding chancellor, Mr. Naveen Jindal, in the memory of his father, Shri OP Jindal. JGU has a phenomenal and unparalleled faculty ratio of 1:9. Schools at OP Jindal Global University cover a wide range of humanities, public policy, journalism, banking, arts, law, psychology, and liberal studies. Thanks to its outstanding faculty members and researchers who've collectively produced 5,000 publications and counting. JGU has laid strong emphasis on creating a world-class university that provides global education with interdisciplinarity across schools and programs. This is supported by JGU's world-class educational infrastructure and resources that are at par with globally recognized standards. The university classrooms, equipment, pedagogy, and overall academic culture conforms to the cutting-edge modernizations in technology and developments in global learning environments for the benefit of our students. After an intellectually strenuous day, students can make their way to sports grounds. Replete with amenities, students have the opportunity to sport under the guidance of highly qualified and experienced coaches. JGU also houses a performing arts academy, which serves the purpose of a performing arts theatre, a movie theatre, and a state-of-the-art conference hall. JGU's global library has a collection of over 60,000 print volumes and a globally exhaustive corpus of electronic resources. The university operates a health center that helps students, faculty, and staff today, as we return to a resuscitated, reoxygenated environment, we commit ourselves to our mission and vision like never before. Welcome to OP Jindal Global University. May you have a great year ahead.
Great. So this was how the Jindal Global University looks like. So before we begin, you all must want to know how our the hostels looks like, what kind of food that we provide to our students, the kind of buffet that we spread for our beloved students in the campus. It will be one of the wonderful experience to watch a very short video before we open up the floor for the question and answer session. So this was all about how our mess and hostel facilities and life at Jindal Global University. As you all know, we are 100% residential campus, and we are hosting almost 10,000 students, in which we have 60% female candidates, as we have established ourselves as one of the most safest university campus in the country. And the students, or the female students and male students from other 20 countries have also preferred Jindal Global University as one of the premium education provider in the country. So welcome back, everybody. And I would like to inform all of you that now you can open up your mic, or you can put your questions in the chat so we can answer if any. Although we have plenty of questions you already submitted while registering. So since those who are here, we would be happy to answer your questions. So some may want to know, is there any chance of working in hospitals as a public health worker?
Yes. Hi, Soumya. I'm assuming you mean after your training and not while studying. Yes, definitely. I think there are a lot of opportunities in the health sector, and particularly the hospitals, in terms of working. You can obviously, like, depending on your training and depending on the minors that you take in terms of specialization, I think you can specialize in a particular field. Hospital related administration and management or within the health sector is something that you can definitely pursue within JGU. I think there are a lot of competencies within JSPH, but you also, when you join JGU, you also have the opportunity of learning policy and management related courses across sort of the schools within JGU. And it really depends on what your interest is. A lot of people choose to sort of work as epidemiologists within sort of the hospital industry, but you can also work in terms of hospital management, administration, and take on the different roles within it. So I think there is definitely a scope for doing that if that is what you're interested in pursuing.
So I just wanted to understand from Professor Marks, what kind of scope that you see for the public health trained professionals in India, and what are the best possible places where people can look for the employment?
Well, that's the question that Professor Bansal addressed, is that range of government, non-governmental, private employers who need people with the training in public health. So the variety is extremely vast across all of these sectors. Because of our particular focus on human development, it's more likely that the government and the non-governmental sector is more appealing, but that does not include the private sector at all. There are many companies that can use public health specialists, but job opportunities abound. And I'd like to return to the point that I was making earlier about the workforce gap. There is a great need to increase jobs in the workforce area, again, in the government and non-governmental sectors. And as Nitesh pointed out, in the governmental sector, you have not only the national government, but the state government and the local level and all of that. So, but I think that question was addressed by Nitesh, and if there's any specifics that the questioner would like to ask, please clarify.
Nitesh, we just wanted to understand how the industry is welcoming the trained professionals, because there are so many people with the different kind of background. They prefer to get into this sector, maybe doing BA sociology, political, normal humanities graduates, some students who complete the social work qualification, and they again get into the same industry. So how do we differentiate the public health professionals to start their career in the industry?
No, that's the beauty of this profession called public health, because it cut across the profession and the domain. I mean, you're not limited to, unfortunately, we understand health with medicine, which are actually totally different. Health is actually something which relates to medicine, but not altogether. So health is something which has to do with sociology also. It is connected with your economics as well. it is connected, of course, with medicine, but this also gives you an advantage if you have some training in medicine. But if you have a training in sociology or psychology or basic science, even physics, chemistry, that, it also gives you an advantage to understand logically or rationally to get into public health. Industry really doesn't differentiate between your background when you've done your Master of Public Health. What they look is your deepness and your understanding about subject of public health per se. I mean, if you come with a healthcare background, it could be an advantage, yes, sure. But if you come with economics background or a sociology background, it will give you a additional advantage, because it's all about understanding the diseases and making your interpretation and how it could help the society, or how it could help formulating those policies or implementing those policies. So it's not only about just understanding the healthcare. All professions which are either sociology or history or geography or something are more than welcome to take up this, and industry is very much welcoming. This actually gives a diversity in the workspace in terms of public health. Maybe, Nandita, if you'd like to add something on that.
I mean, I think Professor Marks had sort of also, Nitish wonderfully said it's a very applied field. But Professor Marks had also, when he started, his talk, like the introduction to public health. So one of the things we learn very, very early on as we start the MPH is that health providers are really looking at an individual perspective. They are looking at the individual, they are looking at a disease and so on. But I think when you come into public health, you're looking at health from a population perspective. You're thinking about broad trends. You're thinking about, you're sort of problem solving all the time. And you're really driving some of the narrative in terms of health policy. So I think that is the real distinction. I don't think having, it's a very applied field. And as Nitish said very rightly, different sort of areas of expertise give you different sets of advantages in the field. So certainly coming into this field, I don't think that should be a barrier that, I'm a doctor. Does a doctor have an additional advantage? Not really. I think it really depends on what you want to do, what you have specialized in, and what you're looking at. So I would just say that COVID has really taught us that it's not just about curing, but it's really about managing systems. It's really about thinking about delivery of vaccines. And those are not just skills that doctors can do. You need a whole range of healthcare professionals who are really driving the system. So I'll just stop there and for more questions.
So yes, so over to this, Nandita and Nitish, we just wanted to understand how the industry really welcomes them, because the persona in India is like you have to be medical professional when you enter into this sector. But is there a difference? Do these normal graduates are being treated differently, and how they welcomed?
No, that's what I said in the beginning. No, there is no difference. They are welcome as equal as, as Nandita also re-emphasized that. It's more of individual approach. It's all about what kind of quality they bring on table and to the organization. It really doesn't matter whether you come from a healthcare background or a normal science or a basic science or applied science background. What matters is your understanding, your passion about being in a public health profession or a domain. So when you come into a university, yes, all of them are put in a equal footing. Some may feel they have advantage coming from a different because they are familiar with terminology. But when you deal with that, when you go through that courses, I think you actually adopt in a better way. So I generally feel there is no differentiate between. I mean, there could be a bad public health professional, even if he has come from a medical background, and there could be a fantastic public health professional who has come from a chemistry background. So you can't really generalize something that it could be. So I think industry is very much open, and the biggest factor, and Nandita said that thanks to COVID, people have realized the importance of healthcare. It's not only about treating patient or preventing. There's a lot of things which actually goes into implementing those strategies or policy, where healthcare workers coming from diverse background really help. If you ask me as a personal opinion, I would rather prefer somebody coming from a non-healthcare background. I mean, don't sound me a bias towards them, but yes, because they bring a kind of a diversity on table or in the group.
I'm just going to add one very brief point on this. What really matters, I think, if you're considering, I'm thinking what motivated the questioner to pose this question. If there is a field where you find that there is a job opening, you look carefully at the job description. And if that job description corresponds to what you'd really like to be doing in your professional life, your qualification with an MPH is likely to prepare you for that. For example, one of the specializations that we have in year 2 is mental health. So there can be a particular professional job that has a job description, and when you learn more about it, you find out that, well, a specialization in mental health in the context of a broader MPH covering these health fields is an adequate qualification for this job, and I want this job. So it's the job description that really matters. And with the MPH, it opens up the door for many exciting jobs of that type.
I was only going to add the same thing, really. I think I don't see, particularly in the development sector, I don't see, I see diversity in terms of having a prior degree in social sciences as a real advantage, because really we're looking at sort of the social determinants of health, looking at solving problems from a public health perspective around mental health, around violence prevention, around child marriage, all of which have impacts on reproductive health, maternal health, and so on. So I certainly feel that having a prior training, and many employers in my view actually look for things like, well, do you have quantitative skills in terms of quantitative methods? They look at management skills, in terms of program implementation. So then having that additional training, I think having a training in administration, in sort of management skills, I think those are really the skills that give a candidate an edge. It's not necessarily just the first degree. So certainly I think JGU provides the opportunity to hone those skills. So we have those opportunities here.
Super. So on this itself, I have received a question from Rituja. She wants to know, since I am a sociology background, will I be finding it difficult to learn this health-related program, the course structure?
No, I think it'll certainly give you an advantage in many of our courses where you're expected to do a little bit of essay writing and looking at sort of programs from a very holistic sort of community lens, from a sociological lens. I think the one area that you must be prepared for, and I think any public health professional should be prepared for, is a little bit of statistics. It's not too bad, but certainly if you've been okay with doing sort of class 10 level of mathematics, I think you should be fine as long as you're prepared to do that. I think biostatistics is a very important part of the program, and it links very deeply with studying epidemiology, which is the core of public health training. So I think that is the part that you have to have an open mind about. So no fear of maths, please. But I think otherwise you'll be fine. Very nice. Great. So Kshitij, before all right. So Soumya, I'll answer your question very shortly, but let us take Kshitij's question. Kshitij want to understand, the MPH course delves into the Indian community service providers. Do we get into to learn about the relationship with the government and community medicine providers? Yes. I think many of our very, very resounding yes. Many of our courses actually will offer you a field exposure, going to a primary healthcare center, engaging directly with providers, but also many courses, both in terms of like year 1, in terms of foundational training, and year 2, in terms of the electives that you choose to do, will directly look at community health, will look at health systems, will look at studying health financing, all of the aspects that really speak to sort of universal health care and coverage. And I think universal health coverage is the big sort of theme that Indian health system has been focused on, particularly more so as we sort of, make healthcare accessible. And this is certainly a very, very strong part of our course. So community health relationships are very important area of study. So coming back to the question related to admission, let me share my screens to give you some idea about our admission process at Jindal School of Public Health. So the admissions to this program are purely based on the merit prepared after you appear on our entrance exam, which is Jindal Scholastic Aptitude Test for Public Health. And this is an online home proctored entrance exam where we check your understanding towards this area as well as your basic aptitude. Additionally, we also understand your writing and reading abilities, and
through giving you a 1,000-word essay that you need to submit in the entrance exam. And once you qualify in the written test, we will send you the invitation to appear for the online interview with the experts. And based on the performance in the interview, the jury members will accept your candidature, and we will offer you the admission in the 2-year Masters in Public Health program. So our next entrance exam is scheduled in the last week of February. That's 20 and 21st of February. The fees for this program is 2.5 lakh per annum, which is being considered as one of the, we are an institution of eminence. There are very limited number of institutions in this country which have been awarded this status of institution of eminence, which gives us a freedom to hire the world-class teaching fraternity from across the globe. You can see our professor, the dean of the Jindal Public School. And similarly, in the university, we have 200 plus international faculty members who have been born and brought up in a different part of the world, who are teaching in Jindal Global University as a whole. So being the residential campus, which you must have witnessed, are a kind of luxury hostel facilities that Jindal Global University offers you. As we charge 2,92,500 all-inclusive fee annually, and that includes your 24/7 electricity, Wi-Fi, heater, triple sharing large size bedrooms, attached washroom. We also do not charge anything for your laundry services, health-related issues. We have a full-fledged health infrastructure in the campus. We have collaborated with top hospitals around, and we have 4 high-tech ambulances available all time, 24/7, to take care of any such emergencies, since we have all sports facilities in the campus, including swimming pool and the horse riding. So, but we don't charge anything for the fee that you see on the screen. That's a fee that we charge. There are no hidden charges as well. So you can imagine the kind of education, the kind of course, the kind of people who are delivering this world-class syllabus in the Jindal Global University, located near to Delhi, is way affordable than any other international university, where you go and spend 2 year, 1 year, and you spend almost 50 lakh or crore, maybe you traveling to any other country. So you feel free to reach out to us in case of any questions related to admission. The moment you submit your application form, we will share with you the sample questions and the syllabus that will help you to prepare. We do not charge any fees for the entrance exam. There's a 1,000 fees for application only. So feel free to reach out to me and Saloni in case of any more questions related to this. The numbers are available in the chat. You can reach out to us, or you can write to us in case of any questions. Wonderful. I think this was a wonderful session today.